Ontario's healthcare system was shaken today by news that the Red Cross being called in to help at one of the province's leading children's hospitals. Opposition MPPs say the need for disaster assistance shows the system is failing, and hospitals like McMaster and Hamilton confirm there's a crisis in emergency rooms. Al Sweeney reports.
Ottawa's Children's Hospital of Eastern Ontario, or CHEO, is facing the same surge of respiratory illnesses as other hospitals, a combination of COVID, RSV, and flu. And the Red Cross acknowledges it'll be sending teams into the hospital to support the staff. Hamilton's McMaster Children's Hospital hasn't called the Red Cross. No one from the hospital would go on camera today, but it released figures that are grim. McMaster reports it's getting 190 to 200 emergency room visits a day, 20% higher than average. Emergency waiting times are approaching 12 to 13 hours, and the pediatric critical care unit is regularly operating at 100% or higher. This kind of news got the Prime Minister's attention.
As a father, but also as a leader, I'm extremely worried about what Canadian kids are facing right now. Families really worried about whether or not they're going to be able to get their kids to hospitals.
But the provincial government says calling in the Red Cross is part of the plan.
But that was certainly part of our planning to make sure we had the care we need for pediatric patients at CHEO and other pediatric hospitals.
It's absolutely incredible to me that we're calling in an organization that deals in humanitarian disasters to help out. And then to hear the government say this morning, it's part of their plan.
Premier Doug Ford was looking for some good news.
We're seeing the pediatric illness actually level. Up in Ottawa, they're seeing a spike, but here in Toronto, we're seeing it level off, which is good news.
I used to work in healthcare, and let me tell you, you are not tricking the nurses on the front line. You are not tricking the seniors and parents that have to wait endlessly when it is clear your healthcare policies over the last half-decade have led to a worsening of staffing crisis in Niagara and straight across Ontario.
We're throwing everything we can at the healthcare system.
The government says it's pouring money into healthcare, but the opposition says it's not enough, and the government's limits on pay increases are driving healthcare workers away.
Other hospitals in Hamilton, London, across the pediatric hospitals across the province are still reeling from an unprecedented surge. How close they are to seeking out humanitarian and disaster relief organizations for assistance, I don't know, but it's a damning indictment that even one hospital in our province has done so.
So this news today is raising the question of whether we should return to mandatory mask wearing to protect children. The Prime Minister says only so far he'll do whatever is necessary to keep Canadians safe.